Hello everyone, my name is Kyle Nart. I'm a nurse practitioner with the cardiac surgery team here at Norton Healthcare. Today I'm going to talk to you about your discharge instructions following cardiac surgery or open heart surgery. First thing we're going to talk about is what you can expect with your activity level following surgery. Things that we ask you not to do is lift more than 10 pounds. Okay, so a gallon of milk weighs about 8 pounds. We ask you to lift no more than that for a period of about 4 to 6 weeks until you see us in the office. At this point, you should be healed enough and that bone should be healed enough to where you can go back to lifting more. And after about 12 weeks, you should be able to resume all activities without limitations. You're okay to walk every day. You're okay to climb stairs if you have them in your home. We just ask you to use caution. Most people ask us, climbing stairs, what's the risk associated with that? Biggest thing is falling. If you fall, most likely you're going to try and brace yourself with your hands, which can injure your chest. So just be careful if you have stairs in your home. If you do have steps in your home, we ask you to limit your trips up and down throughout the day for the first 1 to 2 weeks until you're a little more stable on your feet, especially for our elderly patients. We encourage you to start in our cardiac rehab program at about 3 to 4 weeks after surgery. This program may not be for everyone, but we do encourage it as it will help to build endurance for yourself after surgery and help to reshape that heart muscle and improve your endurance and exercise tolerance. We do ask that you do not drive for 4 to 6 weeks after surgery. This will allow that bone time to heal. We don't want you to drive because if an airbag should deploy on your chest or even a simple activity such as turning the wheel could displace that bone. If you think about the mechanics of how this bone is put back together, if you break your arm, we put you in a cast and we immobilize that bone for a period of about 6 to 8 weeks before that cast comes off. If you have chest surgery, we can't really put a cast around your chest, so we encircle it with either wire or some form of wire. It takes a period of about 6 to 8 weeks for that bone to get set until you're able to get back to doing what you want to do. So next, let's talk about emotions after surgery. It's very common to have mixed emotions after undergoing a big operation. It's common for you to have depression, anxiety, and even worry after undergoing this big life-changing event. These will improve as your physical stamina improves, so you can expect to see improvement of this over a period of time. The best thing you can do for this is to get plenty of rest. You will likely not be able to sleep well for the first few weeks after surgery, and it's not uncommon for patients to tell me they don't sleep well for the first 3 to 4 weeks after surgery. Trying to find a comfortable position is sometimes challenging, and that leads to a lot of these sleep disturbances, so you will find that most patients tell us that sleeping up in a chair or a recliner of some kind will help in sleep aid. Should you need anything to help you sleep, we ask you to reach out to your primary care provider to put you on something for that, or you can even start with something as simple as melatonin over the counter. Do not be discouraged if you're sleeping at odd times during the days or napping. That's really common, especially as your activity level and your stamina continues to improve. Understand that emotions are common after this procedure, and should you have any questions and concerns, please do not hesitate to reach out to the cardiac surgery team or your primary care provider for further management and recommendations. Now let's talk about medications after surgery. We're going to go through several of the medications that you may go home on, and most patients will go on a combination of these after surgery, and not every patient will be on the same medication. So we're going to hit the high points, a very high level of some of the medications that you can expect to be on once going home. But again, if you have particular questions about these medications, either talk to your pharmacist, your primary care provider, or your cardiac surgery team member prior to discharge home, or even when you get home at your virtual hospital appointment. As we discussed in the previous video on the hospital side, your medications will be delivered to your room by our hospital pharmacy, and a pharmacist will meet with you at that time. Any medication refills after that initial prescription is given, we ask you to contact either your cardiology department or provider or your primary care provider for any future medication refills, as the cardiac surgery team generally will only be seeing you for the next 1 to 2 months. And we want to make sure any of those medication refills don't fall through the cracks and you get the appropriate medications that you need. Again, questions, please contact the office and we'll be certainly able to answer anything you have. So the first medication we're going to talk about is metoprolol, or you've heard this referred to as Lopressor. This medication is a beta blocker and it's used to help lower blood pressure and heart rate. It can also help improve muscle contraction of that heart muscle if it's weak. You may go home on this medication, you may not, so please ask any questions to your healthcare provider if this is a new medication for you. If you need to pause the video at any point while we're going through these medications, please do so now, as there's going to be side effects and common things that are associated with these medications and pertinent points on each of these slides. So please feel free to pause and resume when you're ready. Next medication that we're going to talk about is furosemide or Lasix. Some of you may already be on this medication prior to surgery. Some of you, this may be a new medication. Some of our surgeons use this on every patient following surgery, and some use it sporadically, and it depends on really your condition, what's going on with you at the time you're discharged home. This medication is a water pill, so it helps to pull extra fluid from the body. It's not uncommon after heart surgery to gain anywhere from 10 to 20 pounds following this procedure. So you may notice some swelling in your feet and ankles. You may have some shortness of breath for a period of time. So we work to get that fluid off and get you back to your normal state of health prior to surgery. Again, pause here if you need to read through the side effects or have any further questions about this medication. One of the things we really need to be careful when you're on this medication is watching your electrolytes. As we talked about previously, with Lasix comes electrolyte imbalances, especially potassium and magnesium. So don't be surprised if you're going home on potassium replacement in addition to this water pill, and we'll talk about potassium here in a moment. So speaking of potassium, it's an electrolyte that we will replace anytime you're on a water pill. We generally will dose this once or twice per day, and it's due to you losing that electrolyte from the water pill. You can see that some of the side effects are listed here. One of the common complaints we get with this medication is a very large pill. If you have trouble swallowing pills, please do not hesitate to call our office, and we'll see if we can switch this over to a liquid for you if need be. But if you have any further questions, contact your primary care provider or your cardiology or cardiac surgery team members to answer anything further. Next medication we're going to talk about is docusate sodium or Colace, or really any over-the-counter stool softener is okay after surgery. As we talked about previously, we want to make sure that you're not straining and putting any strain on your chest when having a bowel movement, as this can cause injury or pain. So for the first few weeks after surgery, until that pain subsides and that bone really gets healed, we want you to remain on a stool softener. If you run out of these, you can certainly take something over the counter. If you need something more than this and you're having constipation, certainly contact our office and we'll recommend something for you. Please don't take anything over the counter to produce a bowel movement without first clearing it through your primary care provider or your cardiac surgery team member, as this can affect some of your other medications. The next medication we're going to talk about is aspirin. Almost every patient will go home on some form of aspirin after surgery. This is an antiplatelet medication, and it prevents your blood cells from clumping together and sticking together after surgery. Especially if you've had valvular surgery, we don't want anything to stick to those new valves that we've put in. But again, this medication can behave sort of like a blood thinner, so you have to be very careful while you're taking it to notice any bleeding or any side effects associated with it. In addition to aspirin, most patients will go home on Plavix. This again is an antiplatelet medication that prevents your platelets or one of your blood cells from clumping together, and it also works to kind of help thin the blood. So we teach patients to think of it like a blood thinner, although it's really not a blood thinner. You can see some of the side effects listed below are very common, or very similar to the common side effects that we see from blood thinners such as Warfarin or Coumadin. And you have to be very mindful while taking this medication of bleeding risk. So be careful when brushing your gums. If you notice excess bleeding, nosebleeds, bloody bowel movements, those are all things you need to report to the cardiac surgery team immediately, because it may indicate an underlying problem that we need to address further. Amiodarone is a medication that we use in the postoperative setting to help with heart arrhythmia issues, particularly atrial fibrillation, which can occur during the postoperative period. There's a good number of patients that sometimes experience this, and we use this medication to help keep your heart in rhythm. You may only be on this medication for a short period of time, but it does have quite a few side effects, so be mindful of these listed below. And we'll make sure you get close follow-up with the cardiology team for a repeat EKG and lab monitoring while on this medication. Again, any questions on this medication, we will have you directed to either the cardiology team or the referring provider who put you on this medication. Hopefully this medication, for those of you that are new to it, will be a temporary addition, and we'll be able to come off of it within the first 2 to 3 months after surgery. For those that were on it long term, you may remain on this medication long term until seen by your cardiology provider after you complete cardiac rehab, at which point they can determine whether or not you need to stay on this long term. Cholesterol medication, a common one we use is atorvastatin. You may be on a different type of cholesterol medication. For those of you that can't take cholesterol medication by mouth due to an intolerance from it, from the muscle pain and aches that sometimes see from a side effect from these, there are other alternatives, and we have a lipid clinic within our Heart and Vascular Center that we can send you to help with dosing these medications and putting you on the correct therapy. It's important, especially after bypass surgery, that we control your cholesterol and make sure that it's very well controlled to prevent any future complications and reduce your risk factors for future cardiac events. Now let's get into Warfarin. This is a older medication that we use. It's a blood thinner. You've sometimes heard referred to it as Coumadin. So this medication helps thin the blood. Sometimes we'll put you on this after valvular heart surgery for a period of 3 to 6 months, depending on type of valve that you had put in. And we also use this after surgery if you've had any type of atrial fibrillation or irregularities. Some of you may have been on this medication long term, and we would resume it at that point. The big thing with this medication is follow-up. This medication requires close monitoring of blood levels and requires you to get your blood levels checked quite frequently. If you're new to this medication, the pharmacist will review all pertinent details with you prior to going home. There are some dietary restrictions that you need to be made aware of that can interact with this medication. So it's very imperative that you have this education prior to leaving our facility. We have a clinic within Norton Healthcare that manages this, known as the INR Clinic or the ProTime Center. So if you live within our service region, we can certainly manage this at this clinic. And it's a simple blood draw. Generally, it's pricking your finger. They have the results immediately, and your dosage may adjust quite frequently depending upon what your lab level is. So again, we'll talk about this more if you're on this medication at time of discharge, but wanted to make you aware of all of the side effects, dosing information, and everything associated with this medication. So if you have questions or concerns, stop the video now, read through this thoroughly, and please contact us with any further questions you may have. So let's talk a minute about your diet after surgery. Your appetite's going to come and go for the first few weeks after the procedure. This is normal. You may not want to eat anything. Smaller, lighter meals are encouraged, as you may be able to tolerate them a little bit better. And we also want you to try and get a high protein diet in the first few weeks. Protein is important for wound healing, and you definitely need this in the first few weeks after surgery. Try and stay away from foods that are high in fat, high salt content, fast food, fried food. Those things are not very good after surgery. Again, you can see here, try to consume foods that are low in saturated fat, sodium, sugar, cholesterol, and caffeine. Really need to watch our caffeine after surgery. For my coffee drinkers out there, make sure we kind of limit our amount of caffeinated coffee that we're drinking. Same with tea and energy drinks. Really be mindful of those. A lot of people ask when they can resume alcohol. It's okay to enjoy a glass of wine or a drink after dinner a few weeks after surgery, but make sure you talk to your healthcare provider about this, as it may interact with some of your medications. Sexual activity is a common question we get after surgery. Most patients feel well enough to resume sexual activity within 4 to 6 weeks. We generally tell patients that it takes them the same amount of energy to climb a flight of steps as it does to have sex, so make sure you are not resuming this too soon. We also need to be mindful of your wound healing and the fact that you do have a broken bone in your chest essentially that needs time to heal. So make sure that you're very mindful of this before resuming any high-risk activity. Let's get on to smoking for a second. It's very imperative that you stop smoking, not only before surgery, but afterwards. Smoking led to some of the coronary calcification and the valvular disease that you experienced, which led you to have heart surgery. So it's imperative that we abstain from this moving forward. It's really the worst thing you can do to your body after heart surgery. And not only does it delay wound healing, it can increase your risk for post-surgical complications. We've seen numerous times where incisions have not healed and people have had to stay in the hospital long term or be readmitted to the hospital for wound care complications due to excess smoking. We have many resources within our facility and within the Norton Healthcare family to help you get rid of the smoking habit. If you want any of those resources or are interested in this, we can certainly refer you to the appropriate location, or you can ask your healthcare provider for their recommendations and they can certainly help you with this. As far as returning to work, this is something that's individualized per each patient. You will need to discuss this with your surgery team member at your follow-up visit. If you do a more physically demanding job and a lot of heavy lifting, pushing, pulling, you can expect to be off work closer to the 10 to 12 week mark. For those of you that are doing more sedentary office type work and aren't lifting, pushing, pulling, doing a lot, you're okay generally to resume work within 4 to 6, maybe even 8 weeks after surgery. FMLA paperwork is processed through our office, generally after surgery, and there is a small cost associated with that. You can expect that process to take a few weeks, so make sure you send that paperwork in as soon as possible if you need it back in a timely manner. My front office at the cardiac surgery office can certainly talk you through this process, and they may have some more questions for you depending upon what paperwork you need filled out. So let's talk about some reasons to contact the surgery office after surgery. So you see a list here. We'll highlight the main ones, but if there's any drainage or foul odor coming from your incision, please contact us immediately, even if it's after hours. We have someone on call 24/7 that can direct you as to what to do. Certainly, if the incisions are red, tender, or hot to the touch, we need to know that. You can expect some amount of redness around the incision, and sometimes some clear drainage is normal, especially from those chest tube sites that you had, but that should resolve over a period of a couple weeks. If it persists or there's any foul-smelling odor, the drainage looks funny to you, please do not hesitate to call us. We'd certainly rather get you in and be safe and make sure there's no complications. If you have persistent fevers above 100 degrees for greater than 24 hours, please certainly let us know. Or if you're having any chest pain or tightness after surgery. This is very hard for patients to distinguish because you just had heart surgery, and it's hard to define what is pain post-surgery and what is actual chest pain. We always tell you, if you have concerns, call us and talk through it with us so that we can kind of understand what you're going through and we can direct you in the right direction if you need to come in and see us, or if you need to go to the emergency room, or if it's simply just post-surgical pain. Generally, chest pain not relieved with pain medication or that gets worse is a warning sign, and we certainly need to know about that. And if that's the case, certainly call us, and again, we'll talk you through what to do. You need to also let us know if you're gaining weight. We generally say 2 to 3 pounds in a 24-hour period, or 4 to 5 pounds in a week is kind of a warning sign. You generally can expect to start losing weight after surgery. Again, if you remember, we talked about earlier in the video, you can expect sometimes a 10, 20, even 30-pound weight gain after surgery. That's not totally uncommon. So trying to get all that fluid back off of you and back to your ideal body weight prior to surgery can take some time. What we don't want to see is you going in the opposite direction. So what we ask you to do is weigh yourself every morning after going to the bathroom, at the same time, generally wearing the same type clothing that you were wearing the day before. Record those for the first few weeks after surgery and keep a log and kind of keep a trend so that we know what's going on. And you can always talk to your healthcare provider if you have further questions. So some more reasons to contact the surgery office should you have any of these following issues. Obviously, a change in any heart rhythm issues. If you feel like your heart's racing or you're feeling like you're fatigued and you feel like your heart rate's going really slow, certainly call us immediately and we can point you in the right direction. Shortness of breath is common after surgery with minimal activity. That will continue to get better. What we don't want is this to continue to get worse. Then we want you to come in and see us or contact us. And then obviously uncontrolled pain. Pain is to be expected after surgery. It should continue to get better. We will send you home with some pain medicine. If it's not helping or you need more, please certainly contact our office. We will discuss a pain regimen for you, and it will become very individualized for you. When you come back to the office, generally it's your 4 to 6 week office appointment. We like to have you off of the narcotics if possible, but we understand sometimes that's not always the case. Some of you may be in pain management prior to surgery, and if you are, we will help to establish a good pain control regimen for you until you're able to get back into your chronic pain management doctor. So let's talk about follow-up appointments for a minute. So you're going to see the cardiac surgery team within 4 to 6 weeks after surgery, and you're going to be expected to see your primary care provider within 1 to 2 weeks after your procedure or from discharge from the hospital. If you have a Norton Healthcare primary care provider, we can help make that appointment for you prior to discharge. If you have a primary care provider outside of the Norton system, it's going to be your responsibility to make that appointment. If you're having trouble getting in with someone, please let us know. We're always available to try and help make you an appointment within our Norton Healthcare family. Or if you'd like to stay with your own primary care provider, that's certainly okay. Cardiac rehab can be expected to start within the Norton system within 2 to 3 weeks. Some insurance companies require you to be seen by your cardiologist prior to your appointment, or even your cardiac surgery provider prior to starting rehab. If that's the case, let us know. And even if you don't know, it's okay. We'll get that sorted out. Most of the time you'll be seen by one of the rehab nurses prior to leaving the facility, and they'll explain the process to you and how that works and when you can expect a phone call to get arranged. If you're doing cardiac rehab outside of the Norton system at one of our regional facilities or one of our regional partners, just let us know and we'll try and get with your cardiologist who may be going to the outreach clinics near you, and they can help us arrange your follow-up visit at cardiac rehab. Speaking of cardiac rehab, at your first appointment, you can expect to be there for 1 to 2 hours, and then subsequent appointments will be about 1 hour each. You generally get up to 12 weeks or 36 visits 3 times a week, and you have a year to complete those after your surgery. So we highly encourage you to consider this. It's a very beneficial program. Even if you don't think you need it, it's very beneficial for not only your heart recovery, but also your stamina and fatigue and endurance building. Lastly, we're going to talk about the virtual hospital. So this is a new post-COVID implementation for the cardiac surgery program. This program allows us to see you virtually, either by telephone or on Zoom platform. We can see you 1 to 2 times a week generally for the first couple weeks after surgery. And the goal is to see you until you're well enough to be transferred off to one of the other specialties. So whether you're going to cardiac rehab or your primary care provider, we can help fill that gap, so to speak. We can help with medication refills if necessary, but we do encourage you to contact primary care for that. We also can review your weight logs, blood pressure logs, those type of things. So it's a very good service that we offer. We highly encourage you to consider it. And if you do go home after surgery, we will be contacting you within 1 to 2 days after leaving. So now let's talk about follow up with the cardiac surgery office. You're going to see us in the office generally about 4 to 6 weeks after surgery. At that point, we're going to check your incisions. Most of the time, your activity level has improved by then, and you should be back to most of your daily activities. If you're having complications at this time, certainly let us know. We'll be able to walk you through what to do or point you in the right direction. And if we need to see you beyond that 4 to 6 weeks, we'll certainly set you up an appointment at that time. If you're having any emergent issues prior to follow-up in our office, please do not hesitate to call our office, or if it's truly an emergency, call 911 and get to the nearest emergency room. Again, I thank you for choosing Norton Healthcare. Thank you for trusting us to take care of you with all of your heart and vascular needs. We appreciate you coming to see us, and if you have any further questions, do not hesitate to contact our office at the number below, and we look forward to seeing you. Thank you again.